So today we have Junie again, and this is our training session number 2. We're still practicing the chin exercise. So she needs to place her chin in my hand, and then she had some practice at home with the owners, and now it looks like it's much easier for her already. Chin. So now what we're going to increase the amount of time she needs to rest her chin in my head. Chin. Chin. So now I'm doing 3 seconds. Chin. And since she's very receptive of the 3 seconds, I'm going to start grabbing kind of her muzzle and, being a little bit more invasive here. Chin. 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 So now I want to be able to hold her muzzle, and then I'm going to do it for a shorter period of time, and then I'm going to click and reward. So the point with this chin exercise here today is that I don't want her to ever perceive me grabbing her muzzle and staring at her eyes as something aversive. I want her to enjoy this interaction. I want her to offer this behavior to me. Once she knows the behavior and the word doesn't always have to be there. I know she knows the behavior already. That's solid. Chin. Now the next thing we want to do is be able to hold this muzzle, investigate her mouth, click, and reward. So I wouldn't look at all her teeth at first. I'm going to start with just like lifting her gums. So I want to hold, lift, click, and reward. I don't want her oral exam to ever be something unpleasant or something she would feel like she needs to bite me. And I have my treat here in my hand so she can still sniff it. She knows she's going to get it, but there is something she needs to do for it. Now, if I need to hold her and look at her eyes, this kind of training transfers to anything we want to do in the head area, such as a mouth, eye exam. So I looked at one eye now. Nose. Now I'm going to go to ears. And the next step, the next training session we're going to practice with her will involve tools. So we're going to use an ophthalmoscope and an otoscope to see if she allows us to use the tools that we actually need to do a full examination of the head. Today is our 3rd training session with Junie, and we are ready now where she's very solid with her chin exercise. You can see that she wants it really bad. And today we're going to start using objects on her that will prepare her for actual tools that we use in a physical exam. So it's not the real tools yet for eye exam and ear exam, but we're going to get there. So today we're prepping. We're using things that are not associated with that, such as, and it can be anything. It can be a pen, a thermometer, a tongue depressor. It doesn't really matter, but it's just training for tomorrow's practice. So let's remind her of what we do here. Chin. We're going to start with the basics. Chin. Increase the amount of time that she has to stand still. Chin. Chin. So I'm grabbing her muzzle now. Now I'm going to investigate. Chin. 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 And now I'm going to introduce the tool. Chin. 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 So today there is no light, but I'm pointing something at her eyes just to get her used to this move. Chin. 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 So as soon as I pointed this to her eye, she hesitated a little bit. She gave me a little bit of a movement to the back. So I know that she doesn't like anything pointed to her. So now we're working on this, on desensitizing her to that. Chin. And now it didn't. She didn't. So that's good. That's progress. Chin. I'm increasing the amount of time now that she has to tolerate that. Chin. 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 One more time. Chin. Good job, Junie. Was that fun? Yes? Good job. You did great. See, this is not scary anymore. So tomorrow it's going to be our, hopefully, last training session. We're going to incorporate the real tools that we use for an exam of the head. So we're going to do the otoscope for the ears and the ophthalmoscope for the eyes. So we're going to have the light shining in her eyes, and we'll see how she's going to do. See you tomorrow.